right into this, and I'm going to ask Kim Hostetler, who's a senior executive with the Hospital Association, to start her presentation. Just by way of kind of background, most of you are aware that hospitals throughout the state are facing extreme is probably an understatement, cuts in the proposed budget that the governor put out. And so when we look at these cuts across the state, there's not a hospital in this state that's not going to be devastated by this. There's not a hospital in the state that is not going to have to be faced with a decision about what services can be cut. It will have significant economic consequences on the communities that we serve. As you're well aware, we are so intertwined with the economic health of the community. These cuts are that devastating. Potentially go off the cliff. There's a 2% across the board reduction to all providers, not just hospitals, every provider that receives Medicare payments. So Dr. Kazi's in the room. His rates would go down, cardiologists, his rates would go down by 2% potentially if they don't avert this sequestration cut.
Big hospitals, and the community hospitals will slowly disappear. In other words, you eliminate the competition, and you have the big hospitals, and we have to go to bigger places. If that's the plan, this is a wonderful way of being able to execute.
A lot of state money here, and you're not going anywhere. You're easy targets. You can't relocate like a Pratt & Whitney, like a hedge fund or whatever. So, and then there are no non-cynical answers, unfortunately. But that's what's going on. And so, what do we have to do? Well, I think Tim said it. We have to fight, and this is a good start because there are a lot of legislators up there that don't get it, that are still buying OPM's line that we're making you whole with Malia payments because the situation was a lot worse under Saga. And I know it's not true. Everybody in this room knows it's not true. But there are probably more than 100 people in Hartford that still don't know it's not true.